Hi, my name is Bruno Gobato. I'm speaking directly from Brazil. Welcome to the Metaverse and Shoulder Arthroplasty, how to use AR and VR. For the thank you slide, I like to use this kind of technology to do it. So I'm very happy to be here in Venice, digitally, in this digital world. Thank you, grazie, Dr. Porcellini. Thank you, Dr. John Sperling, for this invitation. I'm very glad to show you how this kind of technology I'm showing in this video can be used for our surgeries in reverse total shoulder arthroplasty and actually in any shoulder arthroplasty. This is an example of a reverse total shoulder arthroplasty plan. But now let's go back to our old-fashioned PowerPoint to continue our presentation. So the objectives of this presentation is to show the uses of augmented reality and even virtual reality for teaching, training, performing, discussing, and thinking about the future itself. First, we have to understand the different terms. Virtual reality, or the VR, is when we are totally immersed with a glass, and we are using the augmented reality, or AR, that's kind of the Tony Stark thing, moving things with your hands. This is an example of a virtual reality of the VR from also VR, which is a totally immersed OR created from computer, so can be used for teaching and training procedures. But how can we use it ourselves? Can we do it free with our phone, with our piece of paper? Yes, we can. So this example of a planning of a reverse total shoulder arthroplasty with graph that you can see in red. So we are using an iPhone app called Augmented, and we exported our planning to this app, and now we can see it in our room as we are with the planning in our hands. And we can see also, for example, a clavicle fracture or any deformity, any bone deformity using this kind of technology. But if we want a little bit more, we can have the same piece of paper folded into a cube called Merge Cube and use our phone to see and check our planning. This is an example of another company planning that we use to check prior to the surgery what we plan to do using this kind of cube called Merge Cube. Just export your planning to the software and you can check it using this kind of cube. But today we are using a different device. It's the HoloLens, it's the augmented reality glass. We're expecting new glasses. Apple, where are you? We're expecting someday. And we used to visualize and perform our arthroplasties. These are some examples of arthroplasties that can be done using augmented reality and extended reality. This is an app from the Evolutis implants. They have an app that you can check your planning prior to the surgery, and during the surgery there are all the steps saved in this app to perform the surgery as you have planned prior to the surgery in your home. This is another example of a planning of a reverse total shoulder arthroplasty. This patient has a retroversion, and here I'm checking this kind of retroversion, and now we can see our planning. So for that, we are not using any special software. We just exported the planning to our glasses, and now we are checking it in our office. And now we have the surgery itself. This is one of our first cases in 2017. It's a patient that has a very severe retroverted and inclinated shoulder. We chose a very big graft, and we used the augmented reality to place the central pin guide in the correct orientation for this patient. We can do also remote assist. This is the field of view from Dr. Mohitaha from Switzerland. I'm following the surgery in my home computer, and he's performing the surgery. And in my computer, I'm using my mouse, and I'm checking the location of the humeral cut. And this red arrow that you see in the image is placed in his field of view, attached to the humeral head. So if he moves, the arrow stay there. And now I'm teaching I'm teaching him how he will perform the humeral cut. This is kind of proof of concept. And this is how we do it ourselves in the OR. This is a representation. This is the glasses, how we place the models We can have different kind of models for different steps of the surgery and how we manipulate them. We can do virtual discussion. This is also Dr. Mohita's field of view. We are discussing a reverse total shoulder arthroplasty. I'm seeing his field of view, he's manipulating the models, and we are discussing ourselves how to perform the surgery. Then we move to a kind of virtual environment in my room, in my office, and now we are discussing a little bit more in depth how we're going to do this kind of surgery. Now I'm grabbing the model, placing the location where we want, and we are discussing how we're going to do and where we are going to place the implant for this case. We can do it with more people. This is a video that we showed in global shoulder arthroplasty, a meeting in Brazil, France, South Africa, and Belgium, showing how we are going to do a reverse total shoulder arthroplasty with Professor Thomas Gregory. And this is our last discussion. I think it was last month. With me, Mori, Firas, and John, we are discussing some cases using the augmented reality. We have the exams, we have the 3D models, we have even pictures from the surgery. And this is how I think is the future of virtual rounds, of round tables for the next few years. So this is our vision. This is how we are doing things. And this is how we imagine is the metaverse for the shoulder arthroplasty. Thank you very much for this opportunity. Grazie. And I'm waiting for your comments. Bye-bye.